Hi, my name's David, and I'm here to explain to you about our new intelliFat kit. Let's review the contents of the intelliFat kit. First, we'll review the cannulas. Our first cannula is our Super G Milli. It's 15 centimeters long, 2.5 millimeter diameter, with 24 holes that are 1 millimeter aperture in size for harvesting millifat. Our next cannula is patented. It's our Super G Micro, used for harvesting microfat. It is also 15 centimeters long, with 300 holes that are 500 microns in size. The next two cannulas are transfer cannulas. One is an 18 gauge, that is 12 centimeters long, with a cup end. The other is a 19 gauge by 5 centimeter long microfacial cannula for those finer applications where the doctor doesn't need quite so much length and wants a smaller diameter. How we go ahead and use these cannulas for infiltration and aspiration. So first we're going to take our adapter. You're going to take whatever size syringe you feel like infiltrating with, tie onto here. You can then use either the Super G Micro or the Super G Milli for infiltration. You'll simply screw it all the way in. Of course, you'll have your saline drawn into here, and you can go ahead and infiltrate. For aspiration, we're going to take our intelliFat syringe, the adapter is already here, and choose whatever our harvesting cannulas we want to use. I'll go ahead and grab the Super G Micro here. We'll go ahead and twist it on. And then once inside the patient's body, we're going to go ahead and draw this to the 10 milliliter or cc mark and give it a slight twist so that it locks into place at that particular position. This creates 0.4 atmospheres of pressure, and then once this gets full, we're going to go ahead and twist again, draw back to the 20, and then leave that in place. And then once this gets full again, we're going to go ahead and twist and draw back until we get to the 30 mark, until we get completely full. Now let's review our filters and our resizer. The first is our millifat filter. It is meant for washing millifat, basically 1 millimeter size adipose clusters. The design function of this is to keep all of your structural adipose on one side of the syringe and allow through the other side waste components. So it's a lure to lure. You simply attach your syringe and push through into a waste basin, or you can go ahead and collect your waste on the other end with a syringe. The same works with our microfat filter. The microfat filter is meant for, obviously, microfat harvested from the Super G Micro, as well as stromal vascular tissue. So you simply go ahead and with your aspirate in one side of the syringe, pass it through until you hit a little bit of resistance, and then stop. Another good feature about both of the filters is that you can go ahead and take saline into one of your syringes and basically go ahead and push off the debris that it caught on the one side, and you can go ahead and continue to reuse this even though it plugs up after filtering so much lipoaspirate. So the diamond cut resizer here is also lure to lure, very simple to use as well, like the other filters here. You simply would attach your lipoaspirate to one end and the same size syringe to the other end, and you would simply go back and forth, pushing the tissue through the resizer until you turn the microfat or millifat into stromal vascular tissue. Some of the accessories included in the intelliFat kit include 2 female lure-to-lure transfers that allow you to basically pass lipoaspirate back and forth between different size syringes, including the intelliFat syringe. Caps That'll allow you to go ahead and keep your lipoaspirate contained within the syringe much easier, especially if you're turning vertical for gravity separation. And lastly, our stroma stamp. So stroma stamp is a microneedling device that you would go ahead and fill with stromal vascular tissue up to 4 cc's or mLs of. You can also put in PRP into here or any other type of aesthetic serum, and you would seal it, take the top off, and as you stamp, this gold pin here compresses and releases fluid while you are stamping the patient. So this is a delegatable part of the procedure for scars or for wrinkles, etc. Microneedling. Let's start with how we're going to go ahead and use the kit during a procedure. Well, first we're going to be doing Temess and liposuction, so obviously the doctor is going to have to go ahead and Temess. We have 2 cannulas and you can Temess with. One is a Super G milli and the other is a Super G micro, based upon the doctor's preference. We can go ahead and start with a Super G micro though, because it'll flow a little bit easier. We'll go ahead and take the adapter, which is the only autoclavable reusable piece that we have. We'll go to the end of the intelliFat syringe, and then you take the cannula and you go ahead and screw this in until it's firm. Takes a few twists, so wait till you get to firm. Finger tight, you don't have to tighten it too much. And then once inside the body, after we go ahead and Temess, we can go ahead and start our harvest. Now, every 10 cc's on our intelliFat syringes will equal about 0.4 atmospheres. And so that way we want to go ahead and cock to the 10 and keep it locked there. It's just with a little twist. You guys will figure out how to use it once you're there using it physically. And you'll go ahead and harvest until you lose negative pressure. And then you go ahead and you go another 10. Go ahead and lock it in place. And then the last 10 and lock it in place. And once you're complete with harvesting, you can go ahead and either transfer it to a large, bank it in a 60 if you want to harvest a lot of tissue, or you can just go ahead and transfer it to something smaller if you want to go ahead and transfer smaller volumes. It's completely up to you. Now that we've gone ahead and harvested into our intelliFat syringe here, we're ready to go ahead and clean up this fat graft. So we have millifat right here. So we're going to go straight into the millifat filter to go ahead and get rid of some of the waste. But first we want to go ahead and, since we got some space in here, let's go ahead and try to clean this up here. So we're going to take a luer to luer. We're going to transfer some saline into here. And we're just going to go ahead and wash this fat. So once it's washed, got a little bit of extra here, which is fine. We're just doing this for demonstration purposes. What we can go ahead and do is we can wait for it to gravity separate. Go ahead and take it off here. We have it now into here. Or we can go ahead and filter it, which we're going to go ahead and do immediately since it's very simple to do. So we're going to take, since this is millifat, we're going to take our milli filter and we're basically going to go ahead and connect it from one side, and then we're going to go ahead and change this into a 10. 10s are easier to work with as we start breaking down this fat. And we're going to try to leave all the structural stuff on one side and the millifat on the other side. So we're going to go ahead and push this through until we hit resistance, and now we hit some resistance, so we'll stop. And what we can do is we can go back here. We can transfer waste into here. And we can just keep on going until we get this all cleaned up. So you want to remember which side you press from. Connect again. And press until you get to some resistance. Now I'm getting some resistance here. Gravity separation does help. And our fat graft is basically a lot cleaner than it was before. And so now we can let this gravity separate further. We can already see the little components in here. And we can continue to do this. We can go ahead and actually take this filter and from the opposite side of which we pushed, clean it back up if we want to, and continue to reuse this over and over again. Now within here, you're still going to get lipids into here, but it should be very small lipids that are not millifat lipids. So If you want to go ahead and process then this down further, you can go ahead and do that with the microfilter, and then we can go ahead and break it down into stromal vascular tissue. So what we're going to go ahead and do is now break this tissue down into stromal vascular tissue. So what I'm going to need to do is just take off our millifilter. We're just going to use the intelliFat as waste. You can see this is all real free floating lipids here, kind of stuff we don't want. We're going to transfer. You can see it's already starting to gravity separate a little bit, which means we could have gone ahead and removed some of the lipids further. We're going to do a lower transfer. It'll be easier to work with 10 by 10s here. Go ahead, and that's enough fat for us to work with. And so with this, we're going to go ahead and create stromal vascular tissue. So we're going to go ahead and use the diamond cut micronizer and pretty much break this down further. And you got to apply a little bit of pressure. You're just going to go back and forth a ton of times. 20 is suffice. And once we're done, we're going to disconnect. Now it's best to let gravity separate. As you can see here, it's all real nicey and frothy. Best to let it gravity separate for a little bit, but if you're ready to go ahead and try and filter it, that you absolutely can. So we can go ahead and disconnect this to continue to use. And we're going to use our millifilter to go ahead and push all the extra fluids off. It's always good to go from top to bottom, let the structural stuff stay on top. And we're going to just gently press this through. And it may block quick since this is a lot of structural tissue here and I can see it all into here. So there's not much fluid coming out. You don't want to press too hard to where you'll break the filter or you'll damage the cells or whatever, but we pretty much have. You have a little bit of pressure. You want to do this in a sterile field. It can get just slightly messy, but we got 8 cc's of stromal vascular tissue here. A little bit of fluid here that we can let gravity separate over time, just slightly, but this is pretty much ready to go. Thanks.